listening to your story is so powerful, and I'm really glad you shared it with us. And as I was listening to the importance of what you said and what you did is directly linked, we can make a leap to very young pregnant women like our Jennifer that's going to talk to you. And I think the thing we share across this span, it isn't ironic, we're going from, pregnancy, pre-birth, early childhood development, and what I'm going to mention, and I'm going to read some facts here, because you alluded to some of them, but I'm going to hit some of these things as they're important. To the next extreme, the mid-age, and then into the fact that we're embracing our elderly. So I guess if I had to think of something that came to me in my head that I want to share with you that I feel passionately about, it's really unconscionable that our state is walking away from people from all life. I mean, I'm here prepared, and as you could hear from Patrick, I primarily do child health work, but also a lot of prevention work. If there's anything we need to do, we need to rally together as a full community and family and not think of things in a compartment. And unfortunately, that's kind of what happened this session. I do a lot of lobbying. And because things were so difficult and so fractured, we do what you do. You retreat and you take care of your own stuff. So as a result, we lost a lot of our power in the fact that we weren't united. Working, we knew there was problems with the disability claim. We knew there was a nursing home stuff. We knew all the stuff was going on. But hopefully this year, and this issue will unite us more as an advocacy group. And we look to you for helping us pull some of that together. But anyway, in the midst of all the things that were going on, and particularly with the Affordable Care Act and the fact that our state is walking away in litigation with other states, but those other states are a bit more wiser. They're taking the money just in case the lawsuit doesn't go through. Anyway, I'm representing some of the folks that do a lot with early childhood development, so in respect to them, I want to talk to you about the one that slid under the radar. I think that as many of us that are involved, and I know there's somebody from, is it Children's Medical Services or a nurse here that's in the room, many of us are aware of the Maternal, Infant, and Early Childhood and Home Visiting Program. But little did we know that the mix of the things that were halted by the decree of the governor and the legislature not to take any of those dollars in that mix under the Department of Health was this grant that had already been in progress. So I want to just say to the press that probably don't know much about this at all, and those of us that are in the business kind of didn't realize what was happening. I want to go over a couple of the things that happened. Despite the children ranking in our state, in the nation, in the very bottom, in almost every indicator of well-being, Florida has lost out of the chance to save the lives of more at-risk children, prevent needless suffering. This makes little sense. It really does. It only hurts the children, and it hurts our economy. I mean, we have to take care of the pregnant women. We have to nurture children and make sure they develop appropriately if we're going to have a strong economy. In previous years, though, that was not the case. We've been very supportive, and especially in home visiting. Now, Patrick mentioned my nursing. Listen, there's nothing new in home visiting. That's been going on in public health 40, 50 years ago, okay? But we know it's proven. So in previous years, we were supportive in evidence-based prevention programs that saved lives and dollars. Yet in 2010, that's when the things started to change. Florida legislature cut $10 million from the successful Healthy Families program, which is a home visiting program, a prevention program, and then Healthy Start program was cut $5.4 million in this year's budget. Now this year Healthy Families was spared, they were maintained, but in that loss the previous year, 14 counties no longer get these important support services. So that's not a good thing. I mean, we forget about this, but it's very, very significant. Now, Florida has walked away from the chance to have additional funds through the Maternal and Infant Child Home Visiting Program. We're going to abbreviate that under the Affordable Care Act that would have infused so many dollars across the state for these programs. It would have strengthened early childhood development, prevent child abuse, and expand valuable home visiting services in the state, a proven way to strengthen families.